Hi everyone and welcome back to my channel. My name is Caroline and today we're going to talk about some treatments for ADHD. Before we get into it, please don't forget to subscribe to my channel, turn on notifications, like this video, share the video, and as always you can also go follow me on my Instagram. That's also called The Art of Being Ill. So before Christmas I did a video about what ADHD is, or rather what ADD and ADHD is, and I said back then that I would do a video on the different types of medicine that you can take when you have ADD or ADHD, and that's what we're going to do today. I'm gonna tell you about some different types of medicines and how they work. So we're just gonna dive right into it. This is my first normal video since I did my Just Breathe journey. I hope you guys enjoyed that a lot. So you can't see it, but I have my computer with me today because there is a lot of information about this medicine and it's quite hard to remember all of it, I might say. So I am going to, so if I look down, it's just because I have to look at my notes so I don't forget how things work. The most common type of treatment for ADD and ADHD is methylphenidate. And methylphenidate is a stimulant. More correctly, it's a central nervous system stimulant. So, and it helps improve focus, attention, and impulse control. So that was like overall what this is and does. But how does it actually work? Methylphenidate works by increasing the amount of dopamine and noradrenaline in the brain by inhibiting their reuptake in the presynaptic neurons. And this sounded complicated, but the most important thing here is that it increases the amount of dopamine and noradrenaline. And these are neurotransmitters, we call them. And these neurotransmitters are crucial for regulating attention. It's staying alert and just focusing and concentrating, adding motivation, so on, so on. Just like any other types of medicine, there are of course some side effects to this. And the most common side effects you see is nervousness or even anxiety, insomnia, so having trouble sleeping, headache, decreased appetite, weight loss, increased heart rate, stomach pain, or nausea. These are the ones you will usually experience, but it's also something that will usually pass once your body gets used to it. The less common side effects we see is elevated blood pressure, mood swings or being irritated, dizziness, like having small tics, skin rash or allergic reaction to the drug, and blurred vision. So these are less common, but they may occur. And then there are some rare side effects, but that you might need to be aware of. And this is things like chest pain, or let me see if I can pronounce this correctly, arrhythmia. I'm so good. It is also hallucinations, mania, or aggression. It is also growth suppression. But this is mostly in children, and dependency. You can become dependent on the drug, especially if you have a past history with abusing substances. It's very common for medicine to interact with other types of medicines. So this is why it's really important whenever you are a doctor's appointment and they want to give you medicine, always mention, I'm taking this medicine already. Is that a problem? Usually it won't be a problem, but there are things like antidepressants that methylphenidate actually interacts with. It can cause something called the serotonin syndrome, which is basically an overdose of serotonin, it will cause you to have fever and stuff like that, and shaking and stuff like that, and it's actually something that's fatal, so it's quite important to be aware of these things. I take sertraline and methylphenidate, and those two together can give the serotonin syndrome, but I haven't had any symptoms of that, so everything has been just fine for me. So, but there are many types of medicine that all medicines can interact with, so it's just important to ask your doctor or look in the index just to make sure that you're not taking two types of medicine that don't go well together. So there are a few things that you should be aware of when taking methylphenidate, and pre-existing conditions is one of them. If you have a history of substance abuse, it's a really good idea to mention this to the doctor before starting methylphenidate, because you might need another type of drug that is less likely for you to get dependent on. Also, there are different conditions that if you already have those conditions that methylphenidate might not be good for. This is things like having high blood pressures, maybe you suffer from seizures, or if you have like a psychiatric disorder such as bipolar disorder or schizophrenia, you might want to mention that for your doctor as well. They should know, but we all know they don't know. So we all know we have to tell them, right? Of course, you also should monitor the treatment, but this is something the doctor 100% sure will do. And it's actually not recommended drinking alcohol when you are on methylphenidate, because alcohol might enhance the effect of methylphenidate. So it's not a good combo. And it's also a really good idea to take it in the morning. The doctor should tell you this, because it can be really hard to sleep when you're on methylphenidate. But by taking it in the morning, it is almost out of your system by night, and this makes it easier for you to sleep. Let's move on to the next medicine type that you can use for ADD and ADHD. And I have to, these names, right? It's like, I want to sound smart, but I'm not always sure that it sounds smart. But the next one is Dexamphetamine. I think that's how it's called. And this is also a central nervous system stimulant. So this works also by increasing the levels of dopamine and noradrenaline in the brain, and it does this by promoting the release of these neurotransmitters and by inhibiting the reuptake in the presynaptic neuron. But again, the most important thing here is that it is increasing the amount of dopamine and noradrenaline in the brain. And again, these are important for keeping your attention, being motivated, and so on. So overall, it actually works the same way as methylphenidate, and therefore it of course also has a lot of the same side effects. So side effects to dexamphetamine is dry mouth, insomnia, loss of appetite, weight loss, nervousness or anxiety, increased heart rate, headaches, stomach, and or nausea. So those are the most common side effects that you see. I'm sorry, I'm looking down my screen. I can't remember all this in my brain. Funny enough, because I have ADD. But anyways, the less common symptoms that you see, but you of course still have to be aware of, is elevated blood pressure, being irritated or having mood swings, sweating, dizziness, fatigue. As you can hear, it's a lot of the same ones as for methylphenidate, right? And, this is going all... Oh, here we go. The rare symptoms that you, of course, still need to be aware of, because they can be quite serious, is psychiatric symptoms such as hallucinations, paranoia, or aggression. It is also something, again, like methylphenidate, something like chest pain and arrhythmia. I have to read it, otherwise I can't say it. Sorry. And of course, also becoming dependent on this drug, and also growth suppression in children. Always tell your doctor what medicines you're taking, because just like methylphenidate, this drug does interact with different types of medicine, including antidepressants and antipsychotics and antihypertensives, and also something for neutralizing acids is actually one of them as well. And also something you use for if you have a low pH level in your body. But I don't think a lot of you are taking that. But again, be aware. And just like with methylphenidate, don't forget to tell your doctor about pre-existing conditions, especially if you have cardiovascular problems, seizures, or bipolar disorder, schizophrenia. Monitoring this treatment is important. The doctor should be doing that. Otherwise, you need to call your doctor and ask why they're not doing that. And again, taking it in the morning so that you avoid having sleep issues at night is a really good idea. And avoid alcohol because those two, they don't go well together, just like with methylphenidate. The next one is actually quite interesting because this, and I have to read up, otherwise I can't pronounce it, Lisdexamphetamine. So this is actually a pro-drug to the Dexamphetamine that we just talked about before. And how does this work? So a pro-drug is the drug that it is before it becomes the other drug. And Lisdexamphetamine is inactive till it is metabolized in your body. And there it will be converted into dexamphetamine, and then it will increase the level of dopamine and noradrenaline in the brain. So it works the same way as dexamphetamine once it's in your body, but it is converted from lisdexamphetamine into dexamphetamine. You might be thinking, so why are we taking this pro-drug, Lisdexamphetamine? And why not just take the actual active drug, dexamphetamine? And the answer to that is that by being designed as a pro-drug, so it's not converting until it's inside your body, it makes the risk of you misusing it, becoming addicted, dependent on the drug, less. So if you do have a tendency of substance abuse, this can actually be a really good alternative to avoid that you become dependent on this drug as well. Again, we have a lot of the same side effects as before. The most common ones are dry mouth, insomnia, decreased appetite, weight loss, nervousness or anxiety, increased heart rate, nausea or vomiting, dizziness. We also have the less common, that is elevated blood pressure, fatigue, being irritated or having mood swings, sweating and stomach pain. And then of course we also have the very rare but also quite serious types of, side effects. So hallucinations, mania, paranoia, aggression, cardiovascular complications such as chest pain, arrhythmias, and of course dependency and growth suppression in children. It interacts with a lot of the same drugs as the two previous, so again, be sure to inform your doctor that you are actually taking other types of medicine. And again, it's really important always to tell your doctor if you have any pre-existing conditions, and it is important to monetize the treatment. Again, the doctor should be doing that. And taking it in the morning so that you can sleep at night, and again, avoid alcohol. So that was today's video. As I'm sitting here and looking at how long this video is, I am considering dividing this video into 2 videos actually, just so it doesn't become too long, blah blah blah. I hope all of this really made sense. I'm not sure because this is difficult and I understand it, but it's actually really hard to explain to people, but I hope you got a little bit out of it. I hope the little graphics that I made it a little bit easier for you. So I guess that was it for today, guys, and have a blessed rest of the day, and I'll see you next time right here on my channel, The Art of Being Ill.